Hello and welcome to episode 25 of Tom's Hirschsprung's podcast. A very special guest indeed this afternoon. I have Ashley Yodkovik with me. She's a podcaster herself, the host of Chronic Convos, and also describes herself as a dog mum and a Broadway singer, and was also a clinical health worker for over 7 years. So welcome, Ashley.
Thank you, Tom. I'm so excited to be here. You were on my podcast recently, actually just like an hour ago?
Yeah, probably less than that, yeah.
Yeah, less than that. But you and I just connected recently and became really fast friends. And so I'm just really excited and honored that I had asked you to be on my podcast. And then you're like, well, can you be on mine too? So I'm just really honored to be here. So thank you so much.
No, thank you. No, it's we've blown the cover of editing within 10 seconds. So people know we're recording this out to sea, but it's all good.
Exactly. We could have a group project after and edit together, right?
Exactly. No,
we used to do it in school, just have like a homework assignment, group projects. Yeah.
Yeah. We'll just end up just copying each other's homework. It'll be absolutely
exactly. There you go. Exactly. I love it.
But no, thank you so much for coming on. And as we said, we've recorded an episode about me for you, and now you're going to do about you for me. So no, it'd be absolutely fantastic. And the reason I wanted to talk to you, this is going to be more of a sort of chronic illness story, but a positive story, a triumph over chronic illness. And boy, do you have a lot of chronic illnesses. But it's yes. We'll talk about a few in a sec. But I'd love to start sort of right really from the beginning, because I've listened to your podcast again, Chronic Convos, and something that's a really good episode in there is episode 5, where you have your parents on, and you told your parents about you as a child and you sort of growing up and not really knowing, having these things happen, but not really knowing sort of what they are or how they affect you. And I'd love to, if you don't mind, to start from there. And to start, you described yourself as quite clumsy, I think, to begin with. But then that just sort of being seen as, oh, well, Ashley's just quite clumsy, but actually it was something a bit more than that thing, wasn't it?
Yeah. Thank you for bringing that up, because now that I'm in my adulthood, and then, like you said, after talking with my parents, so one thing is I was always best friends with the school nurses from and I'm sorry, I don't know what you call it in the UK, but preschool, before you enter like primary school. So like when I was like age 4, I was always that kid that got sick. And I know you get sick as a kid, like a lot, but I was the kid that got everybody sick. Like no matter what, like I would just return from being sick and then I got sick again. So I was best friends no matter what grade I was in, with the nurses. And yeah, I did fall a lot. I did get injured a lot, but doctors would just say, oh, she's growing, she's clumsy. And, there would always be a running joke with my family and my friends. And then even myself, I'd just call myself a klutz. But now looking back on it, I'm pretty sure it had to do with a lot of the forms of arthritis that I have, as well as I've had really bad migraines since 4th grade. And again, I'm so sorry, I don't know the comparison.
About 9 years old, I think, isn't it?
Okay. Yeah, so
probably
right? 9 years old.
Yeah.
But they would always say, oh, you're dehydrated. Like, you need to drink more, and that's why you have a headache. But looking back on it, I'm almost certain it was a migraine. And as you know, I was just in the hospital for a really bad migraine that actually mimics stroke-like symptoms. And so looking back on it, I'm pretty sure, like, neurologically, not that I have a huge neurological issue now, thankfully, but I think that with the arthritis and maybe some other things that were brewing, I think were the reason why I was so clumsy, because I played sports here and there, but I was more of a performing arts person. Like you said, I'm a professional singer, or I'm a trained singer, trying to be professional singer. And so, yes, I did singing, dancing, and acting. I did a little bit of sports, but other than that, I would just play like a kid. But somehow I always like was tripping over something, or I always got hurt. And the thing I remember in fourth grade is this is going to sound funny. I got into a really bad dodgeball accident, if you will. I remember this one boy that like used to love bullying me, and then this other boy who was really good friends with me. I was the last one on my team, which I was really proud of because I was really bad at sports, and I was running on the asphalt, and they both threw the ball at my feet at the same time, and all I remember is like landing on the asphalt. And because I was in karate at the time, I was able to save my face, but my knees like went straight into the asphalt. And I remember kind of blacking out just because even though I saved my face, it was just such a hard hit into the asphalt. Like I blacked out, and I have a scar to this day from that, which actually was the start of like the arthritis I have in my knee. And so I just remember things like that. And again, just always being sick a lot. And when I would get sick, like I would get really sick. Like even if a cold would go throughout my family, like my sister would have it or my parents, it would be like getting the plague, like for me, like, and it took forever to feel better. It would take multiple rounds of antibiotics. So just things like that, I think would always, I just feel like something was brewing, and just a lot of doctors just didn't know, or either they didn't know because it was the 90s, or they just, didn't want to deal with it, which we unfortunately see that too in the medical community. So just kind of crazy how now looking back on it as an adult, how that might have festered a little bit.
Yeah, sure. I think as we were talking about as well, when we did the episode on your podcast about the 90s and about how things, and not to sort of spoil my story, but how things were different in the 90s and how people just didn't know as much, and especially sort of neurological issues and things like that. People just didn't know. And we were talking 30 odd years ago at this stage. So
right.
So it is a completely different time. But I think it's really interesting to look back at that and go, I wonder what would have happened if what we know now would have been applied. But I wanted to talk to you about a couple of conditions that you have, just
Sure.
a couple.
Yeah.
But about, have I got this correct? Fibrom. No, I can't say.
Fibromyalgia.
That's the one.
Yeah.
Sorry,
That's
my
okay.
handwriting is appalling, and I'm trying
That's
to drop my note.
Yeah, and as you and I were talking offline, like it's like we have to like learn how to say our own conditions, right? And then we like abbreviate it. Like in the fibromyalgia community, we'll be like, oh yeah, it's fibro. Like, it's just like, it's kind of like we have our own like dialect after a while, right? It's crazy how that happens. And before I answer that, the only other thing that I forgot to mention is when I was a little kid, I used to get double ear infections and really high fevers a lot. And that'll segue into one of the rare conditions I have, but I forgot to mention that part to set the scene. But yeah, fibromyalgia, kind of interesting. So that was the first autoimmune issue, if you will, that I was diagnosed with, and that was in 2014, so not too long ago. And it was diagnosed with a rheumatologist. And there's 18 pressure points, and I'm pointing to two of them right here, even though this isn't videotaped, but like two of them are right where, where your shoulders kind of meet like your collarbone. And so there's 18 pressure points, and I forgot if you have to have all 18 or like, I think you have to have like a majority of 18 in order for it to be qualified as fibromyalgia. And because there's like no blood test, there's no x-ray, there's no nothing, so it's basically really off of symptomology, and then they like kind of poke you like the Pillsbury Doughboy, if you will, on these 18 pressure points. And and that's how you get diagnosed pretty much. And so I remember when I got diagnosed, I cried for a week because not only did I get diagnosed with that, but that dodgeball accident I was talking to you about, my knee was really hurting. It was really hard to put weight on it. And so I was limping a lot. And they had taken an x-ray of my knee and said, oh, you have the start of osteoarthritis. So being told that, in 2014, so what, I was 25 at the time, and I'm aging myself, and I really don't like that. Anyways, that was hard. I remember my mom was with me, and I just bawled my eyes out. And the reason I did that, it was more so because we had a family friend with fibromyalgia, and that family friend is always very negative about it and always talks about it and always talks about the pain and always just how much it hurts and sucks and, and just keeps going on and on and on, even if that's not what we're talking about, conversation wise. And so in my head, I'm like, oh my God, that's what I'm going to turn into. And so that's why I cried for like a week, but then the light bulb went on. And I'm like, wait a second, it's all about attitude. And so if I choose to be positive, maybe it won't be as bad as I think it is. The interesting part too is, so for a majority of my life, I have been overweight. I was 100 pounds heavier. I used to be 266 pounds. And I'm sorry, I don't know the conversions with kilograms, but I was very heavy. And I lost 100 pounds. And I was able to maintain that because all my life too, that was another thing. My doctors always said, once you lose weight, you'll feel better, right? And you won't have these conditions, right? So it was really interesting that even though after I had lost all that weight, I was still diagnosed with some of these conditions. So it was just kind of crazy how I kind of proved them wrong. And I'm sorry, I misspoke. This was my first autoimmune issue that I was diagnosed with, but I was diagnosed. I had asthma. I was diagnosed with asthma in 6th grade, and then I was diagnosed with a gynecological issue called polycystic ovarian syndrome in middle school, which at the time was also, a lot of doctors didn't know how to treat it, so they just threw a bunch of like hormone pills at me and said, you need to lose weight, and they didn't really know how to treat it, and that felt very isolating. And then they just said, you just need to lose weight and it'll reverse itself. And that was the funny thing too. When I lost all my weight, it didn't reverse itself.
No.
So it's just like, here we are. And it's just like, I don't know if it's just me or if they need to go back and read up on this, because what they're telling me is obviously not true. And so I thought that part was really interesting. And so there would be times where the fibromyalgia does flare. For people who don't know, it's a chronic pain syndrome and it's all over. Like, yes, there's 18 pressure points that are very tender, but sometimes there's certain clothes I can't wear. It literally feels like my skin is crawling. Like, sometimes that's how much it hurts. Sometimes you're in so much pain. We call it a fibro fog, where you can't really put sentences together because you're just in so much pain. Sometimes light and sound will affect it, just the extra stimulation. So it's a really interesting thing. And the other thing is, people call it like a throwaway diagnosis. And my dad, I love him to death, was one of those people. He was in the healthcare system, as you were referring to episode 5 on my podcast. And he called it a throwaway diagnosis, which was pretty painful. And at the time also, they weren't calling it a chronic illness, even though it's something that there's no cure for. And there's, it's an inflammatory disease. Like, it's, you can't get rid of it, and it is inflammation. Like, what else would it be? So it was kind of like there was like this, disagreement within the medical community, but it's kind of like at your expense. And it's like, how do you deal with something like that? And what they throw at you is a bunch of pain medications, or they put me on an antidepressant because it's supposed to apparently help with pain, which it didn't. Yes, there is depression that comes with that. But at the time, I wasn't depressed. I was, again, just really trying to make the best of it. And And like you said with your HD, just kind of getting to know my body, like if I overdid something, like if I stand too long or I need to sit, like things like that, just kind of getting to know like if I've overdone it and what this feels like or what's not, what doesn't feel good.
Yeah, no, and accepting that sometimes can be really, really tough, and going, actually, I need to sit down, and maybe I don't really want to, but I have to, because otherwise, I won't be able to do this, that, the other. And again, listening to your podcast episode, I think episode 1 and episode 5 I listened to, and you said things like taking a shower just really took it out of you. It was really, really difficult, and that kind of shocked me as well. And I knew a little bit about fibromyalgia, a little bit. That it was a chronic condition, and it was pain and whatnot. But yeah, that sort of shocked me a little bit.
Yeah, and so again, growing up, I could not, my parents used to call me lazy because I wouldn't clean my room, and I'd always like be really tired after showering, and I still remember that. And I just thought, and I didn't sleep well when I was younger either. And again, I'm like, oh, well, all my doctors are like, it's because you're overweight. And I would also procrastinate a lot on assignments and stuff. And so, but looking back at it, it's because I wasn't feeling well. It wasn't because I was trying to be lazy. And I even, was talking to my parents about that also offline. And I think some of it like was in the episode. And I thought that was just normal. But now looking back at it, it's like, no. What I was feeling then is what I feel now as an adult. It's really challenging. I still use, even when I'm feeling my best, I still use a shower chair. Because when you think about it, you're doing a lot when you're showering. You're washing your hair, you're washing your body, like you're doing a lot. And I thought that, and I knew being tired after a shower wasn't normal, but at the same time, I'm like, well, I guess other people go through this. But then when I started talking to people who are well, they're like, what are you talking about? And I'm like, oh, I guess this isn't normal. Like, and yeah, I literally have to rest after taking a shower, even using my shower chair, because it's like I just ran a marathon. It's the craziest thing. And people will be like, well, do you feel good after a shower? And it's like, that's kind of like a double-edged question. It's like, I do. It was refreshing, but I feel like I haven't slept in 3 days now. It's the craziest thing ever.
That's incredible. And again, it's not necessarily a condition really that's terribly prevalent in terms of people have heard of it. And again, there might be a lot of people that listen to this who might think, oh, I know what that is. I've known that for ages. But it's certainly not something I hear, talked about all that often. And I'd like to also, as well, speaking about sort of conditions and whatnot, you worked as a clinical health worker for 7 years or so. Is that right?
A social worker, yeah.
Social worker, sorry.
Yeah, that's okay.
Yes, sorry. What made you think I really want to go into that industry?
Oh, well, thank you for asking. A lot of people actually don't ask me that. So, so my passion has always been performing art. But growing up, I was told I wasn't pretty enough. I wasn't talented enough. I wasn't thin enough. I wasn't going to make it. And I let people, I let the naysayers kind of win. Because my passion was to go on Broadway. Despite getting injured a lot, despite not always feeling well, that was my passion. Being on stage, there's nothing like it. Just like you're so passionate about sports. I mean, imagine your life without sports. I mean, that's like imagining my life without performing arts. It doesn't exist, But after a while, I'm like, and then my parents are like, you need a fallback career, because what if you keep getting no? You need a fallback career. And then in high school, I lost my grandmother, who I was very, very close to. And I actually was with her when she took her last breath. And that took a huge toll on me. I I fell into a very deep depression. I finally realized after 2 years and kind of let my grades slip, which having a mom as a professor, that's the worst thing you could do. So I finally realized, wait, my grandfather's still around and I need to, really take advantage of the time that I have left with him. And my grandmother would be so disappointed in me if she knew like I was like being sad and not living my best life in high school and going after what I wanted to. I also was introduced to what suicide was in high school because a lot of people I went to school with tried to attempt it or would do like self-harm behaviors. I had a good friend who would cut herself, and I didn't know what to do, but I knew that I needed to tell like a counselor or somebody like that, like, hey, I know this isn't normal kind of thing. And people just always seem to like seek me out for advice and help. And so I knew that I wanted to go into a helping profession. And so when I was in college, I thought I wanted to be a clinical psychologist, but I really like the hospital setting. I like the adrenaline of like the emergency room and the ICU, and I like the crises. So I learned that through my dad, who worked in a hospital, that, wait, there's not a lot of clinical psychologists, there's clinical social workers. So through that, I wanted to become a clinical social worker. So through that, I just got to, work with so many different populations, with homeless veterans, which I don't know if that's a huge thing in the UK, but it is out here in the US, and I feel like that should be an oxymoron. They're serving our country and keeping us safe, and yet they're homeless. And so if I can do anything to prevent that from happening, I would love nothing more to do about that, because even being homeless, they're still just so humble and so appreciative when you thank them for their service. So it really opened my eyes. I remember it wasn't a veteran that was saying this to me, but a homeless client had just come from one of the offices trying to get income out here. We call it Social Security. I don't know what it's called in the UK. But they weren't treated very kindly. And they had asked me, they're like, why are you being so kind to me? And I'm like, well, you're a human being. Like, I mean, our circumstances might be different, but you're a human being. And they just like started bawling. And I'm like, I wasn't sure. I'm like, did I say something wrong? They're like, no, you just like, you see me, or you see me as a human. And like that has always stuck with me, because I'm like, I'm treating you how I would want to be treated if I were in your situation. I didn't realize that people were so unkind, and so I've always made that a point to, no matter what population I've worked with, just to treat them as a human being and not take it personally, especially in a hospital setting. They're there when they're not feeling their best. But I've worked with homeless veterans. I've worked with severely mentally ill, which is actually one of my favorite populations, because I feel they're the most misunderstood, and I really want to reverse that stigma. But I've worked with death and dying. I've worked with, people in the ICU. Unfortunately, right now I've been on medical leave due to all of my illnesses, but I really miss, working in that environment and just advocating for people. And it's funny, through advocating for others, I did not realize I'd have to learn how to advocate for myself. That's been a huge learning experience for me. So even knowing the healthcare system as I do, I just didn't realize that, you have to advocate for yourself, because if you don't, who is? Your body yourself, your circumstances the best. So you have to be able to let others know that, because they will advocate for you in some fashion, but to, only a certain extent. So I just really love helping people, as you can tell. That's also why I started this podcast, is just I wanted to connect with other people. I was dealt this hand with with this growing folder of health diagnoses, and I hate to tell you, Tom, yes, 10 surgeries is a lot, but I have 28 and counting surgeries. So sorry that I do with that one there. But a little competition here. I've kind of taken pride in that in a sense, just because it's like, okay, if I can help at least one person, then I've done my job. So yeah, sorry, that was a very I feel like I'm giving you like really long-winded answers here, and yeah, so I apologize. I warned you I'm gonna talk. So
No, I love it. I love it. I'd always think that even if we're going to explain something, explain it fully,
Right.
and you do, and there's nothing worse than explaining sort of half baked, and not people thinking, oh well, yeah, I wonder if that, or wonder if that. But
right,
yeah, no,
you like on a novel, like, okay, what's the next chapter kind of thing, like a teaser. Yeah, no, I'm not that type of person.
but no, as I know we were talking so before and offline about operations, and I've never met somebody who's blown me out the water like you have. We're into this many operations. Yeah,
Like it's pretty, but that means so much to me.
But it's and just sort of, I've had 28 operations. I thought, wow, 10 is absolutely nothing. But but no, it's fantastic. And I wanted to pick up on something you said there.
Sure.
About being an advocate, because that's where sort of I first came across you and your podcast, about you being an advocate about chronic conditions and chronic illness, and documenting that via your Instagram page, because it's been going for, is it about a couple of years now, or is it slightly less than that?
I can't remember when I first started my Instagram page. But during the pandemic, like everyone else, I'm just like, okay, like the one thing I didn't do was make bread like everybody else. But I did like, kind of like try like anti-inflammatory diet. So I tried to like, document like different foods I would make for that and everything. Cause that's when a lot more of my chronic illnesses had popped up, was actually right before COVID hit the US. And that's another story. So through the anti-inflammatory diet, because I love cooking, I'm like, okay, let me, the pictures aren't high quality, but like I want to show different recipes and stuff like that. And then actually just within the last few months, my Instagram has really taken off, because I had connected with somebody named Emmanuel Sessignon, who has a nonprofit called WAAA, which is workers with sorry, I always say this wrong, and I'm really bad at this because I'm the director of awareness for it. But it's Workers with Autoimmune Ailments Alliance, and we're turning it into something called Auto Aware. And it's where he too was kind of wronged by our system. He was wrongfully terminated due to an illness he had, and so he wanted to do something about it. Again, we're, just connecting with all these positive people. And so he created a nonprofit where he wants to do legislation where, no employer can do that again to somebody. And where an accommodation to work from home is possible if somebody has a chronic illness. And so one thing led to another. And on top of that, he wanted to do a documentary that is, the hope is eventually to show it to our American Congress out here, to our legislatures, and it's called Invisible No More. So apparently he was really like attracted to my my Instagram handle, Chronically Gimperella, which I can explain the...
Yes, I'm also going to... that will finish my questions along here.
And he asked if I wanted to be a part of the documentary. And of course, at first, I'm like, okay, stranger danger, like, what is this? Like, and so I had to investigate him a little bit more. And then I found out he was legit. And now he's like a brother to me. So, and after I did my interview for it, he and I at the same time were like, okay, so like, how can I get involved? He's like, hey, would you like to be our director of awareness? And I'm like, wait, what? And so right now it's a grassroots thing and it's all volunteer. We're hoping to raise funds where eventually we can do this full time and get paid for it, so we can travel all over and just spread the word, and just, we want to do education and everything like that. But so I've really just I also just decided that I'm a part of a lot of support groups out there, but I wanted to start my own support group, which I did on Facebook. And it's called Spoonie Warrior Chronic Convos. So it's chronic dash Convos. I'm going to change the name because I think it needs to be changed. But it was just a way to give people just a space to feel connected and to be able to talk about whatever. And a lot of other support groups are very limiting, where they don't want you to market themselves and everything. And like you and I have spoken, like we're more than our illnesses, right? So I want people to be able to say like, hey, I'm having this event on, Saturday, or hey, I just started this small business. Like, do you know anybody like that would like, would be interested in this? Like, I want people to be able to have that space. So I want to say in the last few months, I've just been more active, and through WAAA, I was able to start this Chronic Convos podcast. And so we're only about 10 episodes in, but it's just been so rewarding because I've just gotten to meet such amazing people. Like how, I met you, and then just everyone. And again, I've met people in Australia, I've met other people in the UK, and then other parts of the States, and then, just all over the world. And again, it doesn't matter where we're from, we just all connect. And again, if we could realize that we have a lot more in common than we do differences, I just feel like the world would be a better place, and there wouldn't be so much hatred in the world. And I know that's another soapbox, another episode that I'm not going to get into, but like, that's why I love advocating. And to answer your question about chronically Gimperella, so because I got injured so many times, and especially in high school, I was a part of 4 competition choirs, which you had to audition for. And one of them was a show choir. So that was kind of like a Broadway musical where we're singing and dancing and acting all at the same time. So one semester, this was my sophomore year, I had fractured my foot. And I did this because I was trying to calm my dog down, who got really afraid of the rare thunderstorms we have out here, because it doesn't rain a lot, and we don't have thunderstorms a lot out here. And it was dark, and he pulled me in my parents' room, and they conveniently had a fan on the ground with the cord there. And I guess apparently I tripped over it, and by the time I knew it, I was staring up at the bottom of my foot. So my foot was basically like this. But it hurt, but I didn't really realize I had done anything to it until the next day, where I was wearing shoes. And then all of a sudden, like midday, I called my mom, and I'm like, Mom, my foot like really, really hurts, and I don't think I can really walk on it. And sure enough, it turned out I had fractured my foot. So they gave me this walking boot that I swear I looked like a stormtrooper from Star Wars. It was a crazy looking boot, and I have pictures to show it too. But this was right before a competition we had for choir. But, in my head, I'm like, the show must go on. So I was able to wear a different type of brace that kind of blended in with my costume. But some of our competitions were at like Disneyland or like SeaWorld or things like that. And so I was in a wheelchair. And so one of my friends called me Gimperella because the next semester I partially tore my Achilles tendon in the other leg.
Oh.
And so she's just like, you just trip over air, and like we need to put you in a bubble, and you're like, you remind me of a princess, but we're gonna call you Gimperella. And so the name just always stuck, and I'm like, okay, I'm chronically Gimperella, so why not? And then it was funny when I was in a wheelchair, like at Disneyland, of course, all these people who weren't my friends wanted to be my friends so we could get to the beginning of the line, but
yes.
for the ride. But yeah, it's like, you guys, like, go away, you're not my friend. But yeah, so that's where it is. And I know I haven't had any complaints, but I know historically, like, GIMP isn't a PC term, if you will, but 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 for me, it was a nickname that was given to me and it just kind of stuck. And I feel like, why not take pride in it?
Yeah, absolutely. No, it's that's an excellent story because that was one of the things I really wanted to ask, and I'm so glad that there is an actual backstory behind it.
Oh, yep, there is. I got it. I got it to you, Tom.
Yeah, no, thank you. I mean, that's yeah, no, I love that. I love that little listening to little things like that have backstories that rather than. I mean, I didn't think of a funny name for my podcast. It's just basically what it is. It's Tom's First Podcast. It's who is it, what is it, and who is it for? I've got really basic in the marketing,
right?
Yeah, I've been really basic in the marketing department. No expense spared. But no, I and also something else that you said there about being an advocate for chronic illness. And I wanted to pick up on something that was said on your podcast. I believe it was the episode 5. It might have been the episode 1, but I think it was episode 5.
I'm glad you know this better than me because I don't remember which episode it was, but I appreciate it.
But it said that you didn't want your illnesses to overshadow what you were doing that day or what you were doing that week. So if you were going to a party or whatever, you never wanted to, I think it was in your words, like make a fuss, which, I mean, considering you were going through all manner of things, you'd have been well within your rights to go, actually, I'm not feeling too well today or whatever, but you're always like, right, I need to power through this and I need to do this, that, and the other. Have you always been like that with everything in life?
Yeah, I want to say I've always been a pretty tenacious person, even when I'm bullied, because I was bullied growing up, or put down. I was even a part of an organization when I first started getting really sick with some of my other major conditions that I have. I was told that I was making it up, and that I was just looking for sympathy, because I had to miss out on a lot of events because I was so sick. It wasn't by choice, but like I was actually in the hospital or I was on medications where it made it impossible to travel or to drive. And it hurts, but I've always been like, you know what? I'm going to show up anyway. I'm going to show that even though I really am affected by what they said, because, I'm a sensitive person. I wear my heart on my sleeve. I want to say I'm a good person. And I would never do that to somebody, but I'm going to show up. I joined this organization for a reason, but same with like family events. I really don't want to miss out. These are chronic illnesses. And with some of my illnesses I have, there is going to be a time where it's going to be harder to go to things, whether I want to go to them or not. Because especially I have a spinal condition. It's a degenerative condition. And I don't know when all of a sudden it's going to decide, hey, you had these plans, but this is what you're doing instead. I've just always been that type of person. What I've learned to do, and especially with my family and friends, is if I'm at a party or something, I've learned to try to pace myself, or I'll ask them ahead of time, like, hey, can I bring a pillow? Because I know I'm going to need to sit down. Or if I'm helping cook for Thanksgiving or for, a holiday dinner or something like that, I'll be like, hey, I need a chair at the stove, or I try to accommodate that way because, with fibromyalgia too is something I forgot to mention. And the two don't always come hand in hand, but it's very common to also have chronic fatigue syndrome, where the fatigue is so great and people are like, oh, I'm tired, I didn't sleep well last night. No, this is fatigue where it literally feels you have not slept in weeks. It is your muscles hurt. It feels like you had the hardest workout you've ever had, times that you haven't slept in days. It's bad. Yeah. And so sometimes it's the fatigue is worse than the pain, because I can take medications to try to manage the pain, but what can you do besides drink coffee, which doesn't really help for fatigue, right? So, but yeah, I've had friends and family say, well, we sometimes forget you're sick because you don't talk about it. And it's like, well, I don't want that to be the highlight. Like, we're here to celebrate somebody's birthday. And like, if you ask me questions, I'll talk about it. But, you know, and I'll let you know, like, hey, if I'm sitting on a pillow, yeah, my back hurts. Like, but I'm not going to make that the highlight. I guess I've just always been that way. I've always been that person where I don't want it to be about me. And I'm learning that it's okay to make it a little bit more about me, but I've always like, well, that's selfish if I make it more about me. I actually had my voice coach, and you're going to be the first person I'm sharing this with. You know, I've been going through some other like interpersonal things lately. And she said, you know, you're such a great person, but it's like you apologize for taking up space. And that's really stuck with me. And so I guess I've been that person all along. And I'm starting not to apologize for taking up space, but I still will not be that person that'll be like, hey, like, I feel like, you know, I feel horrible, but here I am. I mean, I may say that to somebody, but again, I'm not going to make that the highlight of the day, because I don't want to miss out, because again, I don't know when my conditions are going to change and they're going to make it harder where I will have to miss out on events and stuff like that. And so when I'm getting ready, I will literally start getting ready like 6 hours in advance, because I know I have to take a lot of breaks to get ready. And I hate it, but it is, you know, that it is what it is. So
yeah. No, thank you so much for sharing that. No, thank you. There's and I think it is so important. I know I said probably exactly the same thing on your show. But
well, it just shows how we're aligned, right?
Yeah.
So it's okay. Yeah.
But how you don't want it to define you, yes, it's part of you. Yes, it's difficult, but it doesn't define who you are. As we mentioned right at the very beginning when I did my intro of you, that was pretty much just ripped straight from your Instagram page, really.
That's okay. That's how
I didn't do any extra.
No one has done that for me before, so we appreciate that.
I didn't do any extra work for that. I just ripped it, just copy and paste.
Okay.
Because how you are a Broadway singer, how you are an advocate, how also says dog mum there, which I love, because I have a dog as well, and I love dogs. So anybody who loves dogs is very welcome on this show. But yeah,
I'm just kidding.
Yeah, but how you do so much, and then sort of the chronic illness sort of comes in, and yes, it's part of you. It'll be part of you, like the same way it'll always be part of me. But I love the fact that it doesn't define you, and it's, again, I know we're sort of treading old ground in terms of what I've said to you previously, but I love the fact that, you know, people can achieve so much with having so much sort of not wrong with them as such, but kind of so many of these other conditions. And I love that. I love the fact that, you know, again, you've interviewed some great people. I've interviewed some great people who've done some extraordinary things with chronic conditions. And I love that for you as well. But sort of, yeah, no, I think that's fantastic. And the quote that you said about, was it taking up space? Yeah, if you don't work on yourself, then it's very difficult for you to help other people as well, which I think is something that's always stuck with me, because I'm very much the same. I look at really helping other people and thinking, right, I really want to help this person. But actually, if I'm not fit enough to do that, I can't be in the best space help them. And that took me years to work out. And somebody had to say that to me. You know, I don't know, was that sort of the same for you as well?
Oh, for sure. And I learned that actually when I was interning for my master's degree, that if I don't take care of myself, I can't, like, how am I going to take care of others? Like, how are you going to do it? Like, if you're sick, like, you can't really take care of others. And I learned that because this might be morbid, But when I was working I was working at an inpatient psychiatric hospital for my internship. And a lot of patients that were coming in were former helping professionals or just former professionals in general who didn't get the help that they needed. So they got burnt out really quickly. And that scared me straight. And like when I talked to my supervisor about that, I'm like, so how do you prevent that? They're like, you get help, you realize when you're burnt out, and you realize when you need to take a break. And that scared me straight. I'm like, that'll never be me. And if I can do anything in this world, I'm going to let everybody know in the professional setting, like make sure you have to take care of yourself. Just like with our pets, how are we going to take care of our dogs if we're like really sick ourselves? And I'm not talking about a cold. Like if we just like let ourselves go, how can we take care of our dogs? You know, it's kind of the same thing. And so, yeah, it did take me a long time to realize that. You know, and the taking up space part, like kind of goes a little bit deeper. And again, that would be another conversation for another day. Not that I don't want to get into it, but you know, it's just always been a confidence thing from being told like you're not good enough, you're not pretty enough, you're not any of these things for such a long time. You know, that's where that piece stems from. But, you know, yeah, being given all these conditions, I'm like, yeah, I have all these, but I can't let them define me. Like, how am I going to enjoy life? And again, like I keep saying, I know there was some reason that this hand was dealt to me. I haven't quite figured it out yet, but I'm going to go to brunch with my girlfriends. I'm going to go find out what that new place down the street is. I'm going to go explore that farmer's market or something like that, you know, and I would love to travel. And yeah, it's going to be exhausting and I'm probably going to be in some pain, but it's going to be worth it, you know? So it's just kind of, you have to pace yourself. And I'm not a light traveler because I have to pack so many what if, you know, accessories like heating pads and you can't see it, but I've been sitting on 2 heating pads and a pillow this whole time because, you know, it sometimes hurts to sit up for a long time. But I do it because, you know, it is. And also it's funny too, I don't know if you've ever been asked this. So for people who have like chronic pain issues, there's always a chronic pain scale. So like 1 to 10, or if you've seen those faces, I don't know if they have that in the UK where it's like a sad face and like a mad face or whatever, like in the hospital, which I think is a very inaccurate depiction of what pain really looks like. And there's always this misconception too, where, oh, if your blood, oh, you're laughing right now. Yeah. Yeah. There's always like, well, oh, if your blood pressure's high, then you're in a lot of pain. For me, I'm just as cool as a cucumber. So I can be at a level like 20 pain and my blood pressure is going to be fine. So that's a misconception. But like right now, I'm probably at a pain level of a 6, which is functional for me. You know, I can also function at a pain level of 7. You and I were talking, can't remember if it was on my podcast or yours.
Yep, right.
We have very high pain levels, you know. When it starts getting over a 7, that's where it's like, okay, I need to stay in bed. I need to be on my heating pads. I need a dark room. Maybe I'll put some Netflix on, like whatever the case may be. I can't remember the last time I was at like a 1 or a 2 or a 3, maybe a 4. I've been at maybe, but I can't really remember that. So like normally I'm like out of 5. And I've just learned to accept it. And like you said, I've just really learned to be in tune with my body, which a few weeks ago was super helpful when I was hospitalized, because I was told by one doctor I had to go to the emergency room twice. And the first time I went, I was told I was having an anxiety attack because of my high heart rate, which I was asking you about your tachycardia. I have a history of sinus tachycardia. So after having a really bad lung infection in 2020, whatever reason, it's not because I get excited, but just whatever reason, sometimes my heart rate just goes way up to the 130s or 150s for no absolute reason. And it's just something I've gotten used to. And it was going all over the place, but I also had numbness on my right side. And I was told that was anxiety. And I said, you know what, this is not anxiety. And they're like, it is. And I'm like, no, it's not. Like, and it's not that I have a problem with people who have anxiety, but I'm also a social worker who works in the emergency room. This is not anxiety, and like they didn't want to listen. And that was very painful because I felt horrible, and yet, you know, they gave me like an Ativan and that they expected me to be okay. And then, you know, 2 days later, I had to call an ambulance for the first time ever on myself. Usually I am, you know, setting that up for other people.
Yeah.
So, and then again, that's another story for another day, but that's just how you have to be an advocate for yourself. And even though she didn't end up listening, it's just like, I know my body and don't tell me that I don't, you know?
Yeah, absolutely, for sure. And I'll pick up on the other thing. I know we talked about it on your show, but pain threshold and having multiple surgeries. I found, and I think you've said as well, that you found that having those multiple surgeries, that you've ended up with a ridiculously high pain threshold, and how it takes so much. So because you're like on the scale of 1 to 10, your 4 might be somebody else's 10, or your 6 might be somebody else's 15. You know,
right.
And it was a sort of 1 out of 10 scale. So if there's any benefit to chronic illness, I see that as one, in the fact that it takes an awful lot for someone to hurt me, and I imagine it's the same for you as well.
Yeah, and I don't know if you have this in the UK, so we have an opioid epidemic here in the US, and unfortunately it affects us with chronic illness. So most of my surgeries that are normally outpatient have turned to inpatient. So I'm normally hospitalized, and I'm normally hospitalized because, again, my heart rate decides to go up to the 150s, also due to another illness I have, which is Raynaud's, which is a circulatory thing. That's when, I don't know if you're familiar with it, where it turns like your extremities, your fingers, your toes, different colors, purples, blues, reds. It's really pretty, but, you know, not pretty during the time that it's happening. So normally due to the surgery, that's what triggers it. So that triggers the Raynaud's, which then triggers the sinus tachycardia, which then, you know, I'm a hot mess. But for like the last few surgeries I've had to be hospitalized for 6 days, mainly because my heart rate doesn't want to go back down, but also due to pain control. Like nothing they give me works for my pain. And then they're like, well, you know, we'll give you a Tylenol. I'm like, if you give me a Tylenol, that's like a Tic Tac, and this isn't me pain medication seeking, you know, because I know what that is. Again, working in the system.
You have a benefit.
But it's interesting that certain people in the healthcare system just aren't willing to go for that. Even with the doctor's order, like for me, even morphine didn't help me. Like, I mean, we had to go all the way to Dilaudid, which, you know, you can prescribe it orally, but it's like really, really rare for a doctor to do that. So I was given Percocet, which again, that doesn't really do much. And again, it's not because I've formed an addiction. It's because our pain levels are so high, and we've had so many surgeries that it doesn't work anymore. But unfortunately, with the opioid epidemic here, it's made it really hard for people who actually need pain medications to receive those. But at the same time, it kind of makes me upset because I've had so many patients that I've worked with as a social worker who like get prescriptions for like 80 Percocet, and it's like, I can't even get a prescription for 10. And I just had like a knee surgery. Like, so like, how does that work, you know? So it's kind of like this double-edged sword. And I hope they find a better way to address that, because, you know, sometimes I just won't take anything then. Like, I'll just be in pain and like it sucks, but it's like, what are you going to do? Like, I can't take my last Percocet because then I'm not going to have any. Like, it's just, you know, it's kind of this vicious cycle, unfortunately.
Definitely. No, thank you again for sharing all of that info, because I think it's opened my eyes a lot to saying there's a link between Raynaud's and tachycardia, which definitely, and again, it's something too important to point out. It's not medical advice or anything like that. Please don't take what we're saying.
No. Yeah, I'm not giving medical advice whatsoever.
You know,
right. This is just my experience and what I've dealt with professionally as well as a patient. Yes, please don't take this as medical advice. The only advice I'm giving you is advocate for yourself. And I feel like anybody can give that advice. So yeah, please don't think like, hey, yeah, go take this. I have no idea. I'm not a doctor or a nurse.
No, and even if you were, I've been to
I still wouldn't. Yeah, I still wouldn't give medical advice.
Don't medical advice over a podcast.
No, exactly. No. Not even going there.
No, it's one of the first things I did actually was write a disclaimer. It's been very, very useful. Very useful. But yes, as we sort of wrap up towards the end here, I'd like to just get your take on what does the future look like for you? We talked a lot about the past and sort of past history and lots of incredible things that you've done and your work as a social worker. And what do you think what does your future look like, do you think, the next sort of few years?
Well, do we get to win the lottery in this scenario? Or
that's your scenario. If you do what you want.
Right, okay. I'm just kidding. And as you've seen, I've also not only have I made it not about myself, I've learned to really develop a sense of humor with a lot of this. And some people might think of it as I'm deflecting, but I feel like you have to see the humor in this. I've had a hip replacement and I've had a knee replacement and I'm only 35. And so I'm okay, I'm turning into the bionic woman and I really can't wait. I haven't traveled yet through the airport. So I'm really looking forward to seeing if I set it off, because before that, for whatever reason, I'd always set the metal detector off. I have no idea why. So I'm really looking forward to that. So what does my future look like? That's kind of a tough question. So the bleak part of it, if you will, is I've already been told there's at least 4 more surgeries that I'm going to need in the future. I'm going to need my other knee replaced and I'm going to need my other hip replaced eventually. And then with knee replacements, as long as I don't fall and everything is great, you do need them replaced every 10 years just because of where they're located. Hip replacements, unless I break it, that's good for life. My spinal condition is very questionable, so that might require multiple surgeries. I just don't know when. But without focusing on that part and really hoping that I'm done getting diagnosed with things, because just 5 weeks ago I was diagnosed with Crohn's disease. So without that, I'm really hoping my podcast and just in general, I can connect with as many people as possible in the community and just really spread awareness. And, we can just really create something great. I've noticed with Crohn's that there's not a lot of cookbooks out there. So maybe doing something. Yeah, I know, right? It's really shocking. So maybe doing something along those lines. I've missed singing, so I've gotten back into performing and doing voice lessons. So doing something like that. I would love to have kids. However, with this genetic lottery that I was given, I'd hate myself if any of this was given to my kids. So I don't know if biologic is the answer, but I'm open to adoption, and that's definitely something I'm looking forward to in the future. Once everything calms down, I just started a new medication for my Crohn, so once I know if that's working or not, I'll be able to do that next step. I'm working on my licensure for social work, so I can be a licensed therapist, if you will. So I'm a few months out from that. Yeah, thank you. So I don't know, doing something like that. And then I really hope the organization I'm a part of that made this podcast possible, WAAA, will just really take off and we can just travel all over the nation and maybe even all over the world, just, trying to get rights for people with chronic illnesses. So I just want to be an advocate in one way or the other and travel and set off TSA as much as I can. And, stuff like that. And then again, just have fun. No matter what my future looks like, I just want to have fun and live life to the fullest for as long as I can. And again, even when I'm given something that kind of makes that a little bit impossible, if you will, I'll still find a way. I know I will. I'm not one of those that's going to give up and just like give in to whatever I've been diagnosed with. So I'm excited. And this is a joke from my podcast, but Tom, next Cricket World Cup that's in the U.S., I'll make sure to know about it and to tell you about it, or you'll probably tell me about it. So that's a goal as well.
Definitely.
I still can't believe I had no idea. That's crazy to me, but
Fantastic.
yeah. And then another thing too, and again, this might sound stranger danger, but like some of the people I've met who I feel like were like kindred spirits, like you, like I hope we can cross paths one day, like all meet at a summit or something, you know, just somehow like connect, and just again, it just doesn't feel as isolating that way. So that's what I hope, and you're one of the first people who's kind of asked that question, so thank you for that.
No problem. And just finally, where can people find your story?
Oh yeah. So you can find me on Instagram at Chronically Gimperella. So that's chronically and then GIMPERELLA. I also have another Instagram for my podcast, which is chronic.convos. But you can also find us on YouTube as well as Spotify. And it's a green little circle or square with a golden arch with Ashley Yodkovik, my name, over a golden mic. So, and if you can just like and subscribe, that would be awesome. Really am just trying to get as many subscribers and likes as possible. And I will have a TikTok, and just I need to figure stuff out and be more tech savvy. But yeah, that's where you can find us. And if you're also interested in the WAAA organization that I'm a part of, you can. They also have their own Instagram. So, but you can find that on my Instagram, and it'll lead you to.
Fantastic. Thank you very much. Well, I wish you the best of luck with the WAAA, the Chronic Convos, and everything you're doing as well. It's been a pleasure to talk to you. Thank you so much for coming on.
I'm so honored to have been on here. So thank you so much, and best of luck to you and everything that you're doing as well.
Oh, my pleasure. Thank you.